All right, well, just when the American population thinks things can't get any worse, well, Fidelity just put a new fear in the hearts and minds of many Americans. That is, a single person that is 65 years or older has to have a minimum budget of $165,000 going towards their golden years because healthcare is getting expensive. Now, Fidelity also said that that money should be your pre-tax fund. So that's a lot. There's not many Americans that has $165,000 to their name just solely for healthcare services alone. Majority of Americans don't even own their own home. There's only 27% of all Americans that actually own their own home, according to Wells Fargo. And by Bloomberg, that states that in 2030, that number is going to go down to 15%. So think of that. You're going into your golden years and you don't have any assets to back up your medical expenses because the healthcare sector wants to know your assets before you could even enter their facilities. You ain't got no assets, you're not going to have a great time at those facilities if they let you in the door. So this report from Fidelity sheds some light into the growing crisis that the boomer generation, the next generation, Generation X, and so on and so forth, are about to face head on. And what to do about that is anybody's guess. Just remember, if someone wants to champion the old, oh, we need universal health care, that money's got to come from somewhere. And if you look at the countries that have it, they all have the VET tax, the value added tax. That just means your cost of living is going to be skyrocketing. Even though your healthcare sector is going to be cheaper, your living expenses are going to be so high that you're going to be barely scraping by to afford anything, luxury or not. The other thing too is a lot of these companies are going towards contract workers. I've said this in other videos that I've made about the borderless workforce. The 9-to-5 jobs are dead. So whoever is providing the insurance to these contract workers are offering the cheapest plans possible, and it's not covering anything. I recently had an uncle who blew up his motor in his car, and he had one of those pay-as-you-go warranty companies. Well, come to find out, that motor wasn't covered. So what was the point of having that plan that was called bumper to bumper plan? It's not worth it. That's what you're finding in the healthcare sector. There's a lot of plans out there that have good intentions, but when you get down to the nitty gritty of what they actually mean, it's not all cracked up to be. Getting loans from the bank just to afford day-to-day necessities, from robbing their own retirement funds to pay for their own day-to-day necessities, to save up $165,000 just to set aside for your health care. I look at that as like trying to find the pot of gold at the end of the rainbow. For a majority of Americans, it's not going to happen. I always say use those house savings account, but a lot of them are a joke. They're just waiting for you to croak. That way they collect all the funds. You know, even the 9 to 5 jobs out there, insurance it's not even worth it anymore. I mean, it's something, yeah, but it's not helping anything. And plus, employers are always looking to save money on it, so every year they reevaluate the subject of their insurance policies, and they always try to find a cheaper plan, or they say, well, we offer this new benefit. Well, you look at that new benefit, and it's an 80-20 split, where you pay 80 and they pay 20, or it covers certain things, and then certain things got to be out of pocket before it covers the overall cost, which could be anywhere from a $5,000 to $25,000 basically a fee before they even attempt to say, well, we'll cover the rest. The system of the industrial healthcare is no way, shape, or form on the verge of collapse like everyone says. What it is scraping every single wooden nickel and dime together and figuring out how much they can save every year. More micromanaging. A staff. If you have 5 staff members, well, can we have 5 staff members look after 15 people? Or if we have 2 staff members, well, how do we get those 2 staff members to look after 20 people? I mean, every nickel and dime they're taking out of people just for their overall profits. And a lot to that is to blame on us, because we allowed this sector to take care of us instead of us taking care of us. Instead of realizing that a system like healthcare, that's all it is healthcare. It's not healthcare and industrialized care. There's a great quote. It happened in the 1940s with Winston Churchill. Winston Churchill came to New York, and he fell out of a New York cab and sprung his ankle. Well, when he was at the hospital, they asked him, hey, how are you going to pay for this? And he looked at the staff and he said, I'm Winston Churchill. I'm the Prime Minister of Great Britain. And he says, well, yes, but how are you paying for this? And Winston Churchill said, America's the only country you go to that they grab your wallet before they take care of you. This has been going on for years. And now that the working class people are finally getting to the point where they have to have one light on at night to save electricity, and that one light they have to extension cord run around their house, electricity except that one light to save money, or they have to have a pay-as-you-go meter on their home. That way, when they're not at home, well, nothing's being used. They're saving money that way. I mean, people are on the verge of just overall misery and despair. A lot of people are really thinking now that just living out of your vehicle and living homeless is cheaper than actually finding a place with 4 walls and a roof, because it makes no sense to try to even remotely entertain the rent lifestyle anymore. And now you have a company like Fidelity that is putting oh, by the way, just to let you know, you better save up a little bit more before you put yourself in the retirement home, because you might not be able to afford it. Just putting it out there. That's all I have for this episode. If you guys like this content, please give a thumbs up. Hit the subscribe button if you would, please. Don't forget to tap that notification bell. That way the algorithm knows that you like this content.